Hi, I'm Dr. Eric Finzi. I've been doing liposuction since 1995, and I wanted to tell you today a bit about it so that you really understood how liposuction is done and what are the things that we can do. Now, for starters, there is one technique which is considered the gold standard, and that's called the true Tumescent technique. And the reason why that one really is the gold standard is because it works. Now, there are many different ways to do liposuction, but I think it's informative to know that the top people in the world all use this technique. They don't use other lasers, they don't use other machines, they use the true Tumescent technique. If you have good hands and good eyes and you have a lot of experience, nothing is better, both in terms of efficacy and safety. I've treated about 4,000 people with this technique using local anesthesia. Every single person has been able to get through the technique in the office setting without any type of general anesthesia. That's treating everybody. People who have high pain thresholds, people who have low pain thresholds, it doesn't matter. We can take care of you. Now, why is this technique so powerful? Because whether you're thin, but you just have a little area that is troublesome, like today I'm going to be working on a young woman whose arms are just a little bit out of sync with the rest of her. She's not heavy. It's just that she doesn't feel comfortable wearing short sleeves and going out because her arms are just bigger than the rest of her. And she didn't realize, oh, it's that easy. We can actually treat your arms and it doesn't have to be a big deal. She comes in the morning, we give her a little Valium, relax her, get her calm. Then we start numbing with this anesthesia. It's basically a liquid that we inject into the areas that we're going to numb up. And this has two effects. Number one, she feels no discomfort after it's all done. And it prevents bleeding, which is fantastic. So in 4,000 patients, we've never had any problems, nor has anyone else, with this technique with bleeding. So all the major problems that you see with liposuction don't occur with this technique. That's why it's so safe. So if you follow this technique, if the physician doing it really has mastered this technique, it's like going to the dentist. And when I go to the dentist, I don't worry, well, am I going to come home from the dentist that night? And the same thing with this liposuction. It is that safe. It's just about following the guidelines and doing it appropriately. So what do we treat? Well, I've actually treated the entire body. But what are the most common areas? Your stomach. Then I would say your waist and your flanks, hips. This whole area around here, very common. The legs, the outer thighs, they can be too big for somebody. The inner thighs, the knees. Most people don't realize, wow, you can actually help my knees. You can't work off the fat on the knees. Impossible. I've never seen anyone do it. So that's easy to treat. The arms. Today I'm treating somebody's arms. That's a great area that people don't realize. With this true Tumescent technique, I can treat the arms. Then the other areas, a lot of times, a woman has a bulge around her bra. She might have a bra bulge next to her breast. And it's just unsightly because you've got the nice breast and all of a sudden you got this sort of lump of fat. And it might be back here, it might be up here. I treat that. I also can shape the breasts. If someone's larger than they want to be, but they don't want to have all the scars of a breast reduction, this is a beautiful technique, okay? Because you can make the breast smaller. So we're not talking about it today, but you can also make the breasts a little bit bigger by taking the fat from one area and putting them back in. It's not like a breast implant, but it is your own fat, and so it's more natural. The neck is a great area. So a lot of us carry a little bit too much just down here. This is the simplest area to treat. It's so easy. Takes half an hour, uniformly good result. Okay, so if you've got extra fat here and you're 20 to about 60, this is a fantastic technique. It's not gonna give you a facelift, but doesn't have any of the downside. This is just a couple little tiny nicks in here. They disappear. It pulls up. It's so simple. It works beautifully. And when I say the neck, I also mean the cheeks. A lot of people have extra out here. This is hard to get rid of. So let's say you can't lose the weight and you've got this big neck. It's not attractive. Fine, you can't lose the weight. You might as well look thinner at least. Let's make your neck look nice and clean and smooth and younger. And then if you can lose the weight, great, but at least we're taking care of that. What else? The calves, that's an area that most people don't even think you could ever touch that. I've treated that. There's really no area in the body you can't treat. People get fat in all sorts of different places. Some people might have an area next to their backside that they don't like. It's too big, you know, so it's all about sculpting it to match you. That's the whole key. It's about what's going to look good for your body, because everybody's a little bit different. So the issue is every area of the body is amenable to this because of the tiny tools that we're using. That's the whole key. So that's why I can go into the neck, because the instruments are so small and delicate that your neck doesn't mind. What else is so important? You have to have an eye for this. So nobody can give your surgeon an eye. If your surgeon can naturally see the lines, the curves, the balance, and see that they need to take so much off one area and less off another area, just so that it looks right for you, then you're going to get a great result. Because this isn't following a textbook. You can't just tell somebody, oh, go in there, do that. No, you have to actually see and visualize. You need to be an artist. And that's really important. And I am an artist in my other time when I'm not doing this. And I feel that the two fields are actually helpful for one another, because you need to use your eyes, and it kind of needs to come naturally. It is the hardest part to teach about liposuction, is how is it going to look? Your eye, what are the ratios, the relationship of your hips to your waist, to your abdomen, to your flanks. The whole thing is all about a relationship. You are unique, and you have to be the best looking version of you. I'm not trying to make you into somebody else. I'm just trying to make you into your best version. This technique is really for treating anyone from somebody thin. I've treated people who weigh 90 pounds, believe it or not, to people who are somewhat overweight but not morbidly obese. Okay, it's not a weight reduction technique. It's more, let's say you're heavy, but you're heavier in one area than the other. Let's say you've had 2 kids, and after the children, you start gaining weight on your abdomen, and your belly's just a lot bigger than you want it to be, and it moves around, and the clothes don't fit. So the pants that work for the belly don't work for the legs. This is such a common problem. The clothing doesn't fit. You don't want to have to get everything tailor-made just for that figure. So it could be that there's one part of you, it is bigger, fine. We then use that area, that's the area that we focus on, and after treating it with Tumescent Liposuction, as long as you don't gain weight afterwards, you will keep your result. So this isn't weight loss therapy. This is sculpture. This is about giving you a really good figure. There is a difference. Now, I have taken people who are overweight and over a period of several sessions treated their entire body. And it can be a profound transformation. And I've also taken people who weigh 95 pounds who just have this little bit of bra bulge or this little tiny bit of belly that doesn't look so good in a bikini. They're thin, but you know, you can be thin and still have some extra weight in one little area that no one else is aware of. People ask you, why are you doing liposuction? And that, well, they're not really looking at you in the mirror when you don't have your clothes on. They don't see these little areas. You can hide these things with clothes, but they're still bothersome to people. And the only real reason to do this is for you. You don't do it for anyone else. It's to make you happy, make you feel better about your own figure, your own body. Because if you feel better about yourself, you will be empowered, and it will affect your relationships because you will just feel better about yourself. And I've had people who say they can't wear shorts in the summer, and I'm like, really? Their legs don't look bad to me, but they look bad to them. And if I can help them with their self-image so that they then feel really good about their legs, that's a beautiful thing, because then their legs look better, but they also feel better about themselves. And it all blends together. It's all very important. How do we get ready for liposuction? It's very simple. A week or two before, we have you come in, we just do a physical exam, ask what kind of medications you're on, just get a general picture of health and make sure that everything is going to be safe moving forward in terms of your medications. We usually get a blood test just as a precaution. After that, in 99 out of 100 times, everything is go ahead, and then we give you an antibiotic starting the day before. That's about it. Come on in and we take some pictures. We give you a little Valium just to relax you. We wait till you're very relaxed, which might be an hour. Then after prepping up the whole area, we begin numbing very slowly so that it's still comfortable. And if you do the whole process slowly, by slowly I mean over an hour, hour and a half, it's not a painful procedure. It's a little bit of discomfort, but nothing that 3,000 people before you haven't been able to handle in an office setting without anything but Valium and Tylenol. So we gradually do that. We numb up the whole area. We make sure it's completely numb. Then we sterilely prep you up. And then, and only then, I start the liposuction. Now the key, what's so different about what I do? I use tiny instruments, all right? So you've all heard about surgery, laparoscopic surgery, where you just make these little tiny incisions. They go out and they take out your gallbladder, do all this stuff, and the next day someone's up and about and doing everything. Well, we take it to the next level. So our little tiny incisions are tiny. They're about 1/8 of an inch or less, okay? They're so small, and then we use this little tiny cannula. It's basically a hollow tube that's rounded at the ends so it doesn't cut anything, and has little holes just to suck out the extra fat. And we move that underneath the skin in the fat. And we gradually sculpt down whatever you're working on to thin it out so that you now have a normal layer of fat, because everybody needs some fat. But we get rid of the abnormal layer. And the openings are very small. Because they're so small, it heals up beautifully. I don't use a single stitch in the entire operation, not one. Because it's like having a little scratch on your skin. If you have a little scratch, if it's small enough, you don't need to be stitched up. So the same thing applies here. after we're all done, and I usually tell people it's a half a day. Then my nurses help wrap you up. We squeeze out any extra fluid. We put on special gauze. And basically you go home with a nice dance leotard outfit. And you wear that. And you can walk right after we're done. And you walk to how you're getting out of here. Because you are with it enough. You can talk to me. You know what's going on. You feel okay. You have a little snack after we're done. And the very next day, you can drive. You can pick up your kids. You can pick up a 5-year-old. You can do anything you want. You're not going to hurt yourself. You can walk 3 miles the next day. You can't do that after general anesthesia. This is the technique for the busy woman or man who they want help, but they don't want downtime. They don't want risk. And they want to get on with their lives. You will see the improvement the next day. Your final improvement, that's going to take a few months. It takes about 3 months for you to get about 90%. But the very next day when you look in the mirror, you're smaller and you can see it. And then it just takes a little while. You don't need a lot of help for this area. It will heal up. Your body will do a good job healing. You wear this dance outfit for a couple of weeks. You take it off when you're showering and it goes under clothing. It's just a nice leotard. My patients tell me they feel better wearing it, even if I tell them after a week, 10 days, you probably don't need to wear it anymore, but they like it. So that brings me to a point. When is a good time to do this? Really, any time is fine. Fall, winter, spring are great times because it's a little bit cooler and you can wear this and it's completely covered. No one needs to know. So you can discuss this with your loved ones or not. It's your call. You're doing this for you. You're not doing this for anyone else. So this is private information, and if you feel comfortable, that's great. And if you don't feel comfortable, fine. You just tell one best girlfriend who comes picks you up that day. So the only thing you can't do is that day drive a car. Other than that, everything else, you're fine. It's because we give you some Valium and you're a little bit, it's like having a couple of ounces of wine. And you don't drive when you drink and you don't drive after Valium. It's the same sort of thing. But aside from that, it's very easy. This is the whole key, that this isn't a big deal the way we do it. As long as you stick with the guidelines, that you don't try to treat the whole body at once. All the bad stories you've ever heard about liposuction, they're all from people trying things that they shouldn't be doing. And so it's a no-brainer that if you use this technique and follow the guidelines, it's like going to the dentist. And hopefully it'll be more pleasurable than the dentist. I hope so. So what do you feel like 2 days after the liposuction? Well, you feel sore and as if you went to the gym. Let's say you don't exercise. And you decided that you're going to start lifting weights at the gym, and you haven't done it for years, and you went ahead and lifted some really good weights. Well, you're going to be a little Charlie horse, and you're sore, and you're going to be moving a little achy. Usually, for most people, and the thinner you are, the better it is, usually Tylenol will take care of it. Sometimes a week later, it can be sore enough that you might need Tylenol and Advil. And then uncommonly, there are a few people that they might need a narcotic for a few days in the evening just to help them sleep at night. And that's fine. We give everybody that safety net of a little bit of narcotic. Most of the patients tell me they don't use it, or they used it the first evening just because they were worried. And then when they found out it really didn't hurt that much, they're like, okay, I don't need that. I'll stick with Tylenol. So, but it's normal to be a little Charlie horse. Now, if you're in good shape before you do this, then you're going to heal up much faster. If you've never exercised a day in your life, it's going to take a little bit longer. It also depends on how much fat I take out. So if you're significantly overweight and you take out a lot, you're going to be more sore. If you're 15 pounds overweight, you're not going to be very sore because it's not a large volume of fat I'm taking about. It's more about sculpting your body and giving you the beautiful figure. So it kind of depends on you. But we work with everybody. And it obviously doesn't hurt that much because people come back for their second sight, their third sight. So it's not, this isn't childbirth, okay? This is nothing to do with that. This is modest discomfort, and anybody's ever played any sports knows what that feels like. And if you haven't, that's fine too, but it's you know, the over-the-counter medicines are quite good, which gives you an idea of this isn't super painful. I care both about how someone looks, but also how they feel. So for me, it goes both ways. So if I can use my artistic and surgical skills to shape your figure, then I get a positive feedback because I feel that I've actually done something really useful for someone. So to give you an example, when I first started doing liposuction, one of my earliest patients was a single mom who was very pretty, but she'd gained some weight. Stress of divorce, the whole thing, and she didn't feel good about her image, her neck and her abdomen, and she hadn't dated for 12 years. Now, this was a very pretty woman, but she didn't think she was. She had a very bad self-image because the heavy neck and the belly. Anyhow, I treated both those areas. I just restored her to the way she looked before all the stress and before she'd gained all the weight. It was remarkable. And what was remarkable was the profound effect on her life. So yes, she looked a lot better, but the most impressive thing was that she started dating again. She hadn't dated in 12 years. I found it incredible. Why? She was always attractive, but she didn't feel attractive. So that to me was something that awakened me to the power of how feeling good about your body this is important. This isn't vanity here. This is about your entire self-image. It's all of you. You cannot separate out your mind from your body. They're completely intertwined. And so if you work on one, you will help the other. And conversely, if you completely ignore one, that's not going to be good for the other. So it really is something that's fulfilling in the fact that I can use my hands and eyes, make somebody look better, and then they feel so much better about themselves. And I find it remarkable. I mean, it's a relatively simple thing doing this technique, but if you do it right and it really makes a difference to their self-image, that's a great feeling for me.